Hygiene is utmost important.
So you think we should still put on our masks?
Most of the times it might be an unclean AC vent. So nowadays we are listening more of COVID illness and COVID-like illnesses. Yes, influenza vaccination in adulthood is going to prevent a lot of respiratory infections.
So welcome to the program, Doctor, and it's a pleasure to have you.
Thank you.
So before we dive into some serious stuff, tell us something about your professional journey and what made you choose pulmonary medicine.
So I belong to Warangal. So fortunately I got into Kakti Medical College Warangal. From there my journey began in medicine. So immediately after my medicine, post my internship, I got into the MD program, the PG program here, into respiratory medicine. It was by choice. I was interested into the pulmonary care and critical care aspects of medicine involved in the pulmonary field. So my peak time in pulmonary medicine was into COVID. So my second year, third year, we were tackling a lot of COVID cases, and we were very busy handling cases. And in fact, we had good number of cases who got out unscathed. So I specialize in pulmonary as well as critical care and sleep medicine. And we are also into lung cancers, interstitial lung diseases, obstructive airway diseases, and other aspects of core pulmonary medicine and respiratory critical care part of critical care medicine.
So you think pulmonary medicine was different before COVID and after COVID? Do you see a major change or shift?
The difference was in only awareness from the patient's perspective. Generally, we dealt a lot of viral pneumonias or pneumonias which are very new to the community from long ago. I think so 2010 was the influenza pandemic, which I can remember. After that only we got into the limelight, but I think so COVID has pushed us more into that space.
So what is one myth that you would want people to stop believing about lung health in general, doctor?
Generally, lung health comes with your hygiene, the respiratory hygiene, the etiquettes of different kinds of um, social things which you do, like sneezing, coughing. So the etiquettes which you need to follow. Hygiene is utmost important. Meant to contain a disease or to eliminate a disease. So nowadays people lack this hygiene. They usually think oronasal hygiene is the only part which they do early in the morning for 2 minutes, the brushing and the oral care what we perform. But it's a continuous process. You have to maintain the hygiene throughout the day. So you have to frequently clean your airways. In the morning itself, you can start with a betadine gargle, which will give you almost a fresh breath uh, feel, and later on you can even continue that with regular rinsing of your mouth and even sometimes the nasal airways also. And whenever you feel you are suffocating, so you just wash everything out, you just freshen up again and sit back and work. Don't maintain it for a long duration. So after going home from a busy day, nowadays the air pollution and every other aspects of pollution are interfering with daily activity. So I want people to sit for a moment and think of what care they need to get at home. So taking a proper meal is also important in maintaining all the aspects. Apart from that, I think patients can maintain respiratory hygiene with um, enough advice from a specialist or a nutritionist. But the thing is the willingness of the patient is lacking here.
So you think we should still put on our masks and get whenever we get out the home?
Not every place where you go, but I suggest when you are moving in a city which you don't know that which area is polluted, which area is not polluted, I usually advise my patients to wear a mask and go to your place of work. And even most of my patients who come to me with asthma exacerbations have some kind of trigger even in their office space. So that need to be taken care of. Right? So most of the times it might be an uncleaned AC vent which might be throwing fungal spores into your office space. I don't know how frequently people check the filters of the vents in their office spaces, but if at all you are symptomatic even in your office space, then I suggest you to wear the mask even in office space.
So, next, talking about pneumonia, most of us think that pneumonia is just a bad cough which is not going away. Is that true?
Yes, 90% of the patients with pneumonia present with symptoms of cough with some expectoration on what we call it the sputum, which they expel out frequently. Apart from this, fever is also a common complaint. So, patient usually gets a fever, which might be even high grade at times. So, based on the intensity and severity of the culprit, you get a lot of other symptoms too. But yes, cough is the most common symptom which patients present with. Along with that, patients might also present with shortness of breath. So, these three symptoms are the most common ones.
So, when do you think a patient with pneumonia can land in ICU bed?
Yes, actually, if at all it is neglected in the initial aspects, even though if the patient is even very young, like 20-year-old or 30-year-old, if they are neglected for too long time, like let's say 1 week or so, the patient can land up into ICU. Patient can land up into respiratory failure. So don't delay your symptoms. And elderly patients, especially immunocompromised patients like patients with diabetes, patients with CKD, the chronic kidney disease, or patient with any chronic cardiovascular diseases, even with simple pneumonias can land up into ICUs due to other complications of different vital organs. So nowadays we are listening more of COVID illness and COVID like illnesses. So those are nothing but viral pneumonias which are transforming themselves into ARDS, which is a very dangerous condition which can land you up into ICU, not only ICU onto ventilator, and if at all not taken at the appropriate time, then even the other forms of artificial life supports may be necessary like ECMO or sometimes even lung transplant.
And special population, you mean by?
So the people with diabetes mellitus, which is most common disease in India. Apart from that, we are seeing a lot of CKDs growing in the country. We have the always risk of dyslipidemia with cardiovascular events in the corner. So such kind of patients, especially again patients with cancers who are on therapies or who are not on therapies. Even treatment naive people are also immunocompromised in a cancerous state. So such kind of patients are more prone to respiratory infections. So this is a special population subset which I say even with a mild symptom like cough, which is even dry, you should approach your physician and take appropriate care.
So, as always, prevention is always better than cure. And we hear about these pneumonia vaccines or flu vaccines. Do you think it's really useful for people, or it's just for the season?
So these are proven therapies. These are not some myths, but yes, influenza vaccination in adulthood is going to prevent a lot of respiratory infections, especially influenza illness and other vaccines like pneumococcal vaccine. So pneumococcus is the most common culprit in all the community acquired pneumonia. Apart from tuberculosis in India, we see a lot of community acquired pneumonia happening with pneumococcus. So pneumococcus is also a growing concern in young population, especially children. That's why even the international societies and the national bodies have framed guidelines to give vaccination for pneumococcus in children too. Apart from these vaccines, there are other vaccines which can work for respiratory viruses like varicella. That is the zoster vaccine. The shingles vaccine. So shingles is more dangerous when it comes in adulthood. So shingles vaccine is also one which is preferred in adulthood. Apart from these, we have many other vaccines in the guidelines, but not complete armamentarium is available to us at this point of time. But the Western world has grown out of these advances and have already implemented such kind of things into their routine practice. So they are seeing a lot of less severe infections when it comes to such kind of viral infections.
So, what are some golden rules that you think everyone should follow as?
So mostly the cough etiquettes. So not coughing up in front of the face or into an open area. So if you don't have anything to cover your mouth during your cough, use your elbow. So that is the most natural guard which you can spread. It can stop the spread of the aerosol.
How about steam inhalation? Do you think that's helpful, especially during any flu?
Most common patients which require steam inhalations are patients with allergic rhinitis. So the clogged up pores of the sinuses in the nasal mucosa or anything, they tend to get opened up with this steam inhalation, allowing us to drain the secretions which are locked inside. So this will help in reducing the time of inflammation, and it will also allow the secretions which are already infected to drain out. So this is going to help in such subset of patients.
So, before we wrap this episode, Doctor, what message you would like to share with the viewers out there?
Whenever you find symptoms which are pertaining to a simple cough or some shortness of breath which might be encountered only during exercise or exertion, don't neglect it. Try to get to your physician or whoever the healthcare professional around you so that he can assess you and say whether it is troublesome or not. Neglecting your symptoms is always going to land you up into hospital care eventually. So we don't want inpatient care for every person. So we want to restrict such kind of things only for the outpatient department or completely avoid such kind of things. So my message is to don't delay your presentation or your attendance to your physician whenever you have symptoms.
So, thank you, Doctor. It was pleasure having you on this episode.
Thank you. Pleasure is mine.